All right, welcome everyone. It's great to have you all here. As future nurses and paramedics, you're literally stepping into the front lines of modern medicine. So I'm really thrilled to have you here today for this explainer, where we're going to take a really close look at the profound physiological impacts of addiction. Because listen, we're not just talking about bad habits today. We're talking about complex, systemic pathologies that you are going to encounter every single day in your clinical rotations, whether that's in the ER or out in the field. Grasping the actual mechanisms behind these addictions is absolutely foundational to providing effective, compassionate, and life-saving patient care.
Okay, let's just dive right into our syllabus for today's clinical rounds. We'll be looking at 1. The public health crisis, 2. Tobacco and respiratory health, 3. Alcoholism and systemic damage, 4. Drugs and the nervous system, and finally, 5. The healthcare professional's role.
To really set the stage, we've got to recognize that tobacco smoking, alcoholism, and drug addiction are not just isolated individual issues. They are massive public health crises worldwide. These conditions have a devastatingly negative impact on both the individual and society at large. They're the primary drivers of so many chronic diseases. They drastically decrease life expectancies, and they severely reduce a patient's overall quality of life. As medical professionals, we can't just treat the symptoms. We really have to understand the underlying behavioral risks. Your ability to educate patients and provide the right care at the right time hinges entirely on understanding these exact concepts.
Let's start with Section 1, Tobacco and Respiratory Health.
So the mechanism of tobacco addiction, it all kicks off with nicotine. It's a highly addictive chemical found in cigarettes. When a patient inhales, nicotine crosses the blood-brain barrier in roughly 7 to 10 seconds. That is faster than an IV injection. It triggers this massive release of dopamine and creates a super rapid cycle of dependency. But remember, nicotine is really just the delivery system for the addiction. The smoke itself packs thousands of other harmful chemicals. Understanding this is absolutely key, because when a patient tells you they just can't quit, you have to recognize the immense physiological grip this chemical literally has on their nervous system.
Now, what's really interesting and scary about this is just how systemic the damage from smoking truly is. We so often just think of the lungs, right? But the pathology goes way further. Yes, smoking exponentially increases the risk of lung cancer and chronic obstructive pulmonary disease, or COPD. But it also absolutely ravages the vascular system, leading to severe cardiovascular diseases. Day in and day out, these patients suffer from respiratory infections, a chronic cough, and shortness of breath, which dramatically tanks their overall physical performance. And you are going to frequently treat patients presenting with these exact exacerbations.
And, we absolutely have to consider the community impact here. Addiction does not just affect the individual user. Passive smoking or secondhand smoke is a massive clinical danger. It directly hits children and non-smoking adults who share environments with smokers, significantly bumping up their risk of asthma and other really severe respiratory problems. So a pro tip for the clinic: when you're taking a pediatric patient's history, always ask about environmental exposure to smoke.
So how do we actually step in and intervene? Well, we have a standard clinical protocol that we advise patients to take to prevent severe complications. Step 1 is usually helping the patient make a plan to quit gradually, just to manage that withdrawal. Step 2 involves using nicotine replacement therapy, things like patches or gums, to kind of break the behavioral habit while managing the physical chemical dependency. And step 3 is crucial, guiding them to adopt healthier lifestyle choices to actually repair some of that systemic damage. It requires a really patient, medically sound approach from us.
All right, moving on to Section 2, Alcoholism and Systemic Damage.
The absolute crucial clinical takeaway for you here is that alcoholism is a chronic disease, period. It's characterized by a patient's inability to control their alcohol consumption, even when there are clear, documented negative effects on their health and their life. It is so vital that you, as future medical staff, treat this not as a moral failing or just a bad habit, but as a really complex chronic illness, one that requires a compassionate, evidence-based medical approach.
And this really illustrates the devastating dual-system threat of excessive alcohol intake. It's like a two-front war on the body. On one side, we have severe hepatic trauma. Excessive alcohol physically damages the liver, leading to alcoholic hepatitis and ultimately cirrhosis, where healthy tissue is literally replaced by useless scar tissue. On the other side, we have profound neurological damage. Alcohol attacks the brain, leading to cognitive impairments, severe memory problems, and emotional instability. And hey, this is before we even account for the external risks to public health, like the huge spike in accidents and violence associated with intoxication.
To actually prevent these severe complications, medical staff rely on a few specific targeted strategies. Interventions usually start with counseling and getting the patient integrated into support groups, but we also heavily rely on pharmacological treatments to manage cravings in those really dangerous withdrawal symptoms when necessary. For you, in the clinic, the name of the game is early intervention. The sooner we spot the signs of alcohol abuse, the much better the prognosis is for preserving their liver and brain function.
Okay, Section 3. Drugs in the nervous system.
We really need to clearly define what we're dealing with here. Drug addiction primarily involves psychoactive substances. We're talking about drugs like opioids, potent stimulants, and sedatives. These substances have a forceful, direct impact on the central nervous system. The mechanism of repeated use actually alters the brain's chemistry, swiftly causing deep physical and psychological dependence. Your patients won't just want the drug, their nervous system will actually demand it just to function, and that is exactly what makes withdrawal a true medical emergency.
Now, the acute and chronic outcomes of this kind of abuse, they're just devastating. Clinically, you're going to see a massive spike in heart diseases and sudden cardiac events. Because of intravenous drug use, you'll be right on the front lines testing for and treating infectious diseases like HIV and hepatitis. Plus, that disruption to brain chemistry often triggers or severely exacerbates mental disorders. And, tragically, as paramedics and ER nurses, you are going to be the ones responding to the ultimate consequence: overdose and death.
So, I want you to just pause for a second and really ask yourselves, as future paramedics and nurses, what is our clinical and preventative role in addressing these addictions? We know the pathology now, we know the diseases, but how do we actually shift from just observing the disease to delivering active, life-saving patient care? Which brings us to Section 4, the healthcare professional's role.
All right, let's look at what this actually means for you on the floor or in the rig. Your hands-on responsibilities are going to span both acute and chronic care. Step 1 is diagnostic. You have got to be trained to identify both the subtle and the really overt signs of drug and alcohol abuse during your routine assessments. Step 2 is acute trauma response. Paramedics and emergency nurses have to be ready to provide rapid emergency care during an overdose, like administering life-saving antagonists such as naloxone. And Step 3 is chronic management, continuously supporting and referring your patients out to long-term rehabilitation programs.
But listen, your job definitely doesn't end at the bedside. As medical professionals, we have to focus heavily on prevention and education. You are educators. By informing patients about the actual dangers of these habits, promoting healthy lifestyles, and utilizing routine screening and counseling, you can catch these issues early. Furthermore, by throwing your support behind school education and community health programs, you become vital tools for reducing abuse among both youth and adults on a much broader societal level.
I want to read a quote directly from our clinical text right now because it honestly perfectly summarizes our mission today. Future paramedics and nurses must understand the physiological and social consequences of these behaviors. See, you aren't just treating a failing liver or a struggling lung, you are treating a human being caught in the grip of a systemic disease. By truly understanding this, you directly contribute to reducing the prevalence of these harmful habits and elevating the entire standard of public health.
So, I'm going to leave you with this final thought to take into your upcoming clinical rotations. How will you use screening, counseling, and early intervention to genuinely transform the health of your future patients? You've got the knowledge of the pathology now, so it's time to apply the practice. Thank you so much for joining me in this explainer today, and I really look forward to seeing the incredible impact you're all going to make out there in the field.